Hi everyone, I'm Patrick Miller, a well-controlled diabetic for 18 years. Having had the disease for a longer period of time, I wanted to give some information to those that are newer to the disease which could be helpful. This is the Diabetic channel, where we provide useful information for diabetes. Like and subscribe to receive notification when we post new videos. I wanted to discuss what a blood glucose test is, what an A1c test is, and what they both mean. Let me back up for just 1 minute and give a very brief overview of the body digestive system. In a normal, healthy body, when a person eats or drinks carbohydrates, the body digests this food or drink and converts the carbohydrates to glucose or sugar. This glucose enters the bloodstream, whereby the pancreas releases a hormone called insulin. Insulin allows for the glucose to push through the muscle wall and into the muscles. The muscles then use the glucose for food as the body uses the muscles. A blood glucose test is a measurement of sugar or glucose in the bloodstream at a point in time. It does not say what the glucose was 3 hours ago, nor does it say what it will be later on today. It just says what it is right now. According to the United States CDC, after an overnight fasting of 8 to 10 hours of no food and no drink, a fasting blood glucose reading of less than 70 milligrams per deciliter, or mg per dl, is considered low. Between 70 and 99 mg per dl is normal. 100 to 125 mg per dl indicates you have prediabetes, and 126 or higher mg per dl indicates you have diabetes. If you're a diabetic, the opposite of what I just said does not indicate you're not diabetic. I am diabetic, and there are lots of mornings where I take my blood glucose and my reading is between 70 and 99 mg per dl, which is a normal reading. That does not mean I'm not diabetic. It just means that my blood glucose reading is normal at that point in time, which, all else equal, is a positive thing. A more robust measurement of glucose is the A1c test. Most doctors will order this exam before they diagnose someone with either prediabetes or diabetes. The A1c test is the gold standard for measuring your average glucose. According to the Cleveland Clinic, the A1c relies on hemoglobin, which is the part of the red blood cell that carries oxygen throughout your body. When you have glucose in your blood, it sticks to the hemoglobin. The more glucose that is in the body, the more it sticks. The average red blood cell lives about 3 months, and so this measurement is the average glucose level over the past 2 to 3 months. If you are either pre-diabetic or diabetic, you should get an A1c test at least twice a year. An average A1c of less than 5.7 is in range and normal. 5.7% to 6.4% is pre-diabetic, and greater than 6.4% is diabetic, according to the American Diabetes Association. According to the American Diabetes Association, the goal for most adults with diabetes is an A1c that is less than 7%. The endocrinology advisors says an A1c goal of less than 7% is appropriate, and a more stringent A1c goal of less than 6.5% could be reasonable for individuals if they can achieve this without significant hypoglycemia, which is low blood sugar, or negative impacts on their well-being. I hope this quick take on blood glucose was helpful to you, and if you have questions, please put them in the comment section and I will make a video about them.